I'm Amanda Glassman. I'm the Vice President for Programs and the Director for Global Health Policy. I'm so pleased to welcome such a distinguished panel to the Center for Global Development. We'll be discussing a defining challenge of the modern medical age: the declining effectiveness, misuse, and overuse of existing antimicrobial medicines, and the market failures that have led to stagnation in the pace of new products, as well as new vaccines or extended coverage of existing vaccines that would prevent the need for antimicrobials in the first place. And finally, sensationally, today, this issue is in the media for the first time at the very highest levels. And it's true that developing and protecting these precious medicines is a global public good. Every single one of us, every country, every person will benefit across generations. But it's important to recognize that the burden of resistance resides mostly in low and middle income countries, where there is more exposure to pathogens due to lack of sanitation, poor waste treatment, and little regulation on the use of medicines. CDDEP has estimated, for example, that 58,000 newborns died in India in 2013 from bacterial infections that were resistant to antibiotics in 2013. That's in India. Arvind Subramanian just arrived. That's a bit less than the total number of kids that died from AIDS in the entire developing world. I think that gives you a sense of the scale that this problem represents right now. Since 2009, the Center has been working on the issue of drug resistance for human and animal health, as well as pull incentives for research and development, including the Advanced Market Commitment. And our president, Nancy Birdsall, has long worked on the issue of global public goods and their financing, suggesting that the World Bank open a global public goods window for this use. So while progress is being made, it is simply too slow. Our panel will discuss what needs to happen, but more importantly, how the finance ministers of the world, this week convened in DC, need to think more and act collectively on the problem of drug resistance. So I'm honored to welcome my colleague, Rajesh Murthandani, who will moderate this panel. Thank you.
Thanks very much, Amanda. If I could invite the panelists to please take their seats on the stage, and we'll get straight into it. As they come to the stage, let me introduce them, not that they need any introduction. We have the Right Honourable George Osborne MP, Chancellor of the Exchequer for the United Kingdom. We have Dr. Margaret Chan, the Director General of the World Health Organization. Lawrence Summers, Charles W. Eliot University Professor and President Emeritus at Harvard University, and also CGD's Board Chair. And Arvind Subramanian, another friend and Senior Fellow here at CGD, and currently Chief Economic Advisor to the Government of India. Any one of those would be a headliner, but what a humdinger of a panel we have for you today. So let's get straight into it. Panel, great for you to join us. Thank you very much. Dr. Chan, let's start by asking you to explain for us the public health threat posed by AMR. How big is it? How important? Who's most affected? How urgent is it?
Everyone will be affected if we do not address this problem. Now, antimicrobial resistance has long been an issue, but I'm so happy that this center bring us together and also impress upon ministers of finance why they should pay attention to this issue. Now, Minister of Finance is very good with economic. And I have two good friends here, and Larry, and also Chancellor. This is an issue. It is a development issue.
I too am a friend. I'm not an enemy.
Sorry, my dear. You're a new friend. Okay. On the surface, it looks like it's a health issue. Yes, indeed. But it is a development issue because it touches many sectors. Agriculture, health, and so on and so forth. From my perspective, if we do not address this problem, we will see more deaths in 2030, more death from AMR than cancer. Surgeons will refuse to operate on anybody coming from a car crash. Surgeons would refuse to do any transplant. I'm 68. I may need a hip replacement. Surgeon will say to me, sorry, Dr. Chan, I'm not going to operate on you. Because after all these important procedures, you need to cover the patient with antibiotics. And the pipeline is empty. HIV, TB, malaria, we are seeing a lot of resistance. So what are we going to do? We are in the post-antibiotic era. If we don't take action to make sure that we have investment in R&D, that is a market failure. I'm sure I'll leave the experts to talk about that. Empty pipeline, superbugs everywhere. Infection control is not the best we see in many hospitals. So modern medicine, which is saving life and limbs, improving the health of mothers giving birth and children, all these will be compromised, and it would be reduced in terms of its power to make people healthy and to keep people happy and well, make sure their well-being is addressed. So to me, it's a big problem. And I love Amanda's description about overuse, misuse, and market failure. So those are the areas that we need to address. And just to finish, the World Health Organization working with OIE, FAO, under One Health umbrella, we developed a global action plan. And that should be the blueprint for every country to develop their national plan. And thanks to the leadership of UK, Germany, and many other countries, the UN General Assembly this September will have a very important discussion and debate precisely to bring this issue to the attention of heads of states and heads of government to take a multi-sectoral approach. And the last point I want to make is, this is a global public good. The industry, the pharma industry alone cannot solve this problem. And we need to look at how can countries of the world come together to provide the leadership to address a very big challenge. I call it a slow motion tsunami. Thank you.
Wow, okay. Dr. Chan, thank you very much for those stark words. The issue of global public goods, very close to our heart here at the Centre. We focus a lot on this. We'll be coming on to that shortly. But Chancellor, let me get your perspective on this. As a finance minister, I mean, let's be honest, you have a million other things to worry about right now. Why is this an issue for you? Why is this an issue? Why should this be an issue for finance ministries here this week in Washington, D.C. at the IMF spring meetings?
Yeah, well, first of all, thank you to the Centre for getting us all together. And of course, why are finance ministers and development ministers in Washington this week? We're here because our predecessors, previous generations, set up organizations like the IMF, like the World Bank, to try and tackle problems that no single country could solve. And antimicrobial resistance is precisely such a problem. And you've heard it from the World Health Organization. Resistance to antibiotics could cost more lives than cancer costs. And by 2050 could be one of the great global killers unless we act. And that's not just a human tragedy, it's also a huge economic cost for our countries. And that's why, as a finance minister, I'm particularly interested in it. And what we're really seeking to address is not just a medical development. We're seeking to address a market failure. It does not pay pharmaceutical companies to develop new antibiotics, because at the moment you can use the existing antibiotics and no single company and no individual and no single country pays a price for the resistance that develops as a result of that. Indeed, all the market incentives on pharmaceutical companies, like any company, are to produce something and sell a lot of it. So here we are asking companies to develop new antibiotics and diagnostics that don't necessarily get used right now, but are there for the future. And so as a country, the United Kingdom is interested with others in putting this on the international agenda. As a finance ministry, we're concerned about the economic cost if we don't. And as a human being, I want to avoid the human tragedy if we fail to act.
George Osborne, thank you very much. Larry Summers, antimicrobial resistance falls into a category, doesn't it, of health risks that are truly global. What others do you see out there, and how should the world approach dealing with them?
I want to say two things. First, to just make sure everybody's completely clear on the logic here. Imagine a large number of fishermen and a fishery. and ask yourself what their incentives are. Every fisherman, fisherwoman, believes that if they fish one more fish, good for them, and they don't think about the fact that that's going to deplete the pool. Anyone who thinks about putting some food down for the fish or doing anything else to increase the growth of the fish supply thinks to themselves, I'll only get 1% of any extra fish that are here, so it's not worth making the investment. So economists have known since Adam Smith that if you just leave fishing unregulated and unaffected with no agreements and no coordination, the result will be disaster for all the fishermen and disaster for all the people who consume fish. In precisely the same way, there is a given capacity of these drugs to operate to save lives. If you use it up, which every individual prescriber and every individual patient has an incentive to do, it is not there anymore. Nor does any one actor have a strong incentive to replenish the supply. And so, no matter how committed a believer you are in free markets, you cannot believe that this is a problem that the free market will solve. Nor can you even believe in a world where we may have more and more walls and we may have more and more restrictions on immigration, but we have not yet found the technology that restricts the immigration and emigration of microbes. Nor are we likely to do so anytime soon. So this is not a problem that any one country can solve. So I salute George, I salute Jim O'Neill, who has provided a great deal of leadership. I salute the center, which has been toiling in this vineyard for the better part of a decade, for bringing this problem to prominent attention and starting the dialogue around the necessary solutions, which are, you have to control overfishing. You have to take care of the fishery. You have to control overprescribing. You have to provide new incentives. So I think this is hugely important. Second thing I want to do is put this in a slightly broader context, somewhat broader context, coming out of the work I've done on the Lancet Commission on global health priorities. And I would put it this way. There are three issues, I believe, through which the basic terms of life on Earth can be hugely affected. Two of which are discussed on the front page of newspapers every day, and the third of which is not. It's a rare day when global climate change isn't on the front page of newspapers somewhere. It is a rare day when nuclear proliferation is not on the front page of issues somewhere. Global health, and here I mean the issue of AMR, on which George has shown such leadership. I mean the issue of pandemics. I mean the issue of development of new and effective medicines. If you do a reasonable calculation on reasonable assumptions, time doesn't permit me to go through all the details of that calculation, and you ask, what is the expected risk over the next 100 years from AMR and the possibility that the Spanish flu, like after World War I, will recur? That risk, measured as a share of global GDP, taking account of the mortality burden, is in the same range as the risk of global climate change. It might be half as large, it might be twice as large, but it's not, I promise, 1/10 as large. And yet, to date, the degree of focus that this has received from heads of state, from the broad activist community, is much, much less. And that's why I think dialogues like the current one are important. But ultimately, this is not about dialogue. This is about action. And that's why I think it's terribly important that heads of state in the months and years ahead charge their governments with devising solutions to the threat of pandemic and to the threat of AMR. And I guess I would conclude on AMR with one of my favorite quotations. John Kennedy, that I think really applies here. John Kennedy said, "Man's problems were made by man. It follows that they can be solved by man." And that is surely true of the issue of antimicrobial resistance.
Larry, thank you very much. Arvind Subramanian, the Chief Economic Advisor to the...
Sorry, I was just reminded of a Will Rogers quote. If stupidity got
I
us...
start with John Kennedy, and you go to and you go to Will Rogers. Who's coming next?
If stupidity got us into this mess, why can't it get us out?
Well, let's hope that's not the solution. Arvind, India has some of the highest levels of antimicrobial resistance. How does the Indian government see this challenge, and what is being done about it there?
Can I step back before answering and address a broader question, because I think that's relevant to this. You know, I think fact number one is that we know from all the evidence. I start with this. Let's say there's a given stock of international goodwill that has to be devoted to many of these collective challenges. Fact number one is really surprising that we know that goodwill has translated a lot into giving what I would call, country to country aid, whatever. You give governments a certain sum of money. We know the evidence on that is that kind of assistance has, if you're either minimal or if you're an aid skeptic like me, actually negative, but it doesn't matter. So in terms of returns, they're pretty low, but in terms of how much money has gone in relative to global public goods, I think it's a kind of almost negative correlation between the returns from that compared to how much investments we've made in that. So the ratio of international goodwill that gets translated into global public goods as opposed to giving traditional country aid is just completely skewed. So the question is that, why as we as a collective entity have not been able to even, shift that a little bit more towards global public goods and less towards these other forms of lending which have at best limited value. So, and that's a really big question. If we achieve a modicum of success on that, then it comes to the second issue that between these global public goods, what kind of mechanism should we have to allocate it between different priorities that we see? Because the question that you asked is a question that confronts us at the national level, but it's the same question that applies at the international level as well. So just to give an example, why would you allocate some, by the way, I see the problem, and AMR I think is a huge challenge. It's something that affects India a lot, also because we overuse antibiotics in India, perhaps even more than other parts of the world. But the question is, nationally and internationally, what is the mechanism by which we decide? For example, I'll give you one example. At the international level, I might make a case that, given that climate change, as Larry says, is a big problem, that a large part of resources should be devoted to, say, cleaning coal, for example. I'm just making it up, but that's one example. So the point I want to make is that how do we create a mechanism or a process or whatever that will allow first a shift to take place towards global public goods, and then within that, we have, if Larry is right on the numbers, then maybe climate change and AMR should occupy a huge amount of resources. But then there are others who would say, what about R&D in African agricultural productivity, for example, or anti-malaria? So these are thorny questions that you have to confront. And my view is that, the one global public good that we know had an enormous impact was the Green Revolution. It was a global public good. The returns are 40, 50, gazillion percent. And yet, our allocation to this internationally over the last 30, 40 years has been minuscule. So I think so in this case, like with everything, the enemy is us. So I think we need a better way of addressing this. And if we do that, then the problem of AMR, I think, will also naturally, get the greater attention that it deserves.
Okay, so the quick point from Larry Summers, and then we'll go to the Chancellor again for ideas about solutions.
I want to disagree with something Arvind said. Arvind had a model, which was there was only so much global goodwill, and you had to decide on where you were going to allocate it. And that's a model. Another model would be, and that would be like the model that says, I can only lift so many pounds in my life. Another model would be that if I actually start exercising and I succeed, my capacity will increase substantially. And so if I lift more this year, I'll be able to lift much more next year with less effort. And that's the model that I would prefer to adopt for thinking about global cooperation. And I think if you look at the world's more successful moments historically, they have exactly that character. There was a burst of global institution building after the Second World War that was hugely productive. And that didn't use up the goodwill, so there wasn't any left to solve problems afterward. That created more goodwill, so there was more capacity to solve problems. So I happen to think George is right in putting great emphasis on AMR. I happen to think I'm right by putting great emphasis on pandemics. But whoever exactly is right, one success in global public goods doesn't crowd out the possibility of another. It creates room for the possibility of another. And I think the thing we economists have to appreciate is that because there are often trade-offs, it doesn't mean that there are never win-win solutions. And it's the task of political leadership to find those win-win solutions. And I would suggest if we solve one of these problems, it will actually make us more likely, not less likely, to solve the next of these problems.
Okay, thank you. George Osborne, Dr. Margaret Chan, let's think about the issue of AMR then. What is the heavy lifting, Chancellor, that you think the world needs to do now in order to make sure that we can lift more and more in the future? What are your potential solutions for AMR?
Well, first look, I very much agree with what Larry was saying about, successful international cooperation breeds more successful international cooperation. But it's also the case that at any one moment, there's a limited number of things that can be discussed at the G20 meeting or the IMF meeting or the World Bank meeting or whatever it happens to be. So, one of the tasks and one of the reasons, that we're having this discussion is to get this onto the international agenda, get it discussed by the health organizations of the world, the leaders of the world, the finance ministers of the world, and so on. I think in the end, the solution lies around providing a financial incentive to pharmaceutical companies to develop new antibiotics and new diagnostics, i.e. diagnostics being, in this context, tests that see whether you need to provide an antibiotic. And Larry was kind enough to mention Jim O'Neill. Jim O'Neill is a British economist, a very successful free market economist who invented the term BRICS, so that was already enough for one life. But he has now come into the British government. He works as a Treasury Minister in the UK. And he was tasked before he did that with tasked by the British government, with looking at what we could do to find a solution to this market failure. And his solution, and we're still awaiting his final report, which will come in the next few weeks, his solution is essentially around finding a global payment system to address this fact that there is no financial incentive for a pharmaceutical company to develop a new antibiotic, or limited incentive, let me put it like that. Because A, it won't necessarily be needed immediately, and so the patent is ticking and all of that. And B, the incentive once you develop the product is to sell as much of it as possible, as I mentioned. So if you want to develop a new stock of antibiotics, you need to find some new financial reward. Now, the costs seem quite large. To develop, say 15 new antibiotics, it is said, I'm not the expert on the cost of medicines, but it's said would cost something like $15 to $20 billion. Obviously, it sounds like a lot of money and is a lot of money, but actually in the context of the global medicine market, that's something like 0.25% of annual medicine spend. But you, the consumers, we the consumers, are not prepared to pay for that through the market. And so we need to collectively, as governments and international organizations, find a way of providing those financial incentives. And that's essentially the core of the solution. Now, how exactly that is done, I have some idea of what Jim's recommendations are going to be, but I don't want to steal his thunder. So, we will wait to see his precise proposals on the global payment mechanism that could be developed to reward those who develop new antibiotics.
Just before we hear from Dr. Chan, I just want to follow up on that. Presumably you're not coming to Washington and saying, hey, governments, we're going to do this. We're going to stump up the cash to do this. You're not coming with that message, are you?
Well, one of my messages I communicate a lot at home in Britain is, of course, it's not my money or the government's money, it's everyone's money. You pay your taxes and in many parts of the world you elect governments to decide how to spend that money. So we have to find a source for the financing. It's either going to come from taxpayers or it will come from the industry itself. But we want to do this in a cooperative and collaborative way. And I think Jim O'Neill's ideas and the ideas of the World Health Organization and others, and I should also mention in dispatches Sally Davis, our Chief Medical Officer in Britain. Margaret has brought her book. She is, she's also done a heroic job in getting this onto the international agenda. So, I would say we're in the foothills of this. And if you, to use Larry's analogies of climate change and the like, it's being discussed. We're trying to get it into the communiques. We're trying to get it onto the international agenda, and we're having some success. But I think this year, maybe next year, are going to be absolutely crucial in seeing whether it has clears the coning tower, as they would say in Cape Canaveral.
Margaret Chan, let me bring you in here. What are your ideas?
I'm not an economist, but sitting here listening to economists who talk way beyond their area of expertise is really refreshing. Larry, I want to commend you for your leadership in chairing the Lancet Commission. And he is absolutely correct. Look at the leaders in your country. Which one, when they go to the election, this is happening in US now. Do not talk about jobs, education, and health. And after election, they normally forget health. And the global health issue is really important on an individual basis, on a family level, but far too few countries pay attention to this. Now, you talk about AMR, pandemic, and climate change. If you put them together, these to me are all failure of prevention. They are all related to unregulated. The misuse of antibiotics starts also with the health sector. Why do we as an individual ask doctors for antibiotics when you don't need it? Doctors are under tremendous pressure from patients. And why do the agricultural sector, we support the agricultural sector to use antibiotics appropriately to treat sick animals as doctors treat sick patients. But when you use them as a growth promoter, we have problem, and that amounts to misuse. So we are not here to blame any sector. We are saying that policy coherence is important. Governments, the different sectors, be it agriculture, health, food, because agriculture produces food, be it the chicken you eat, the fish, or the beef. And do you know that they are laced with antibiotics? Because too much antibiotics are used in the agricultural sector. So you get free antibiotics when you pay for your meat. But that's not so good, right? Then the bugs become very smart. Microbes, by its very nature, will mutate. It is a détente between human and microbes. So how can we bring together policy coherence? That's why we move to the presidents and the prime minister of countries. Nobody else, including George, can tell the Minister of Health what to do. Yeah, maybe you can use your influence a little bit. Yeah, the money. But policy coherence is important to me, and prevention can be done, and you can get win-win-win situation. If you look at an antimicrobial resistance, pandemic, and climate change, all these have health impact on an individual, on women, on parents. So I would appeal to all of you, champion on an individual and family level. Talk to your political leaders, what you want them to do with your money.
Okay, Larry.
Give you my take on policy with respect to this, painting with a very broad brush. I think you need three things: morals, prices, and incentives. Let me say a word about each. Everybody, almost everywhere, knows that it's wrong to litter. Because it's not that they're dumping one piece of paper out the window is going to do any damage, but they know that if everybody does it, the whole society won't work. And yet, I'll bet half the people in this room, at some point or other, when they had a child with a strep throat, didn't wait 2 days for the strep test to come back, but decided they might as well start a course of antibiotics because it wouldn't do any harm if the child had, it wouldn't do any harm if the child didn't have strep throat, and it would do good if the child did. And so this idea that we're depleting a common pool by overprescribing, doctors don't think about it, patients don't think about it. There's no sense of morality around it, the way there is around litter or keeping yourself sanitary. And over time, we have to build consciousness to fix that. Second, prices do matter. When the price of gasoline goes up, people figure out how to drive smaller cars. They figure out how to live closer to their place of work. Just look at the way life is organized in different places. Prices over time matter. And here's a bad thing that has predictable, over time, tangible consequences that we don't price and disincentivize. So the fishermen have to have some morality. They have to pay a tax for depleting the stock. So that's morals and prices. And incentives, they have to have an incentive to replenish the stock. And there, I agree exactly with what George said. I would put it in a slightly broader context, which is markets don't reward preparation for disaster. Suppose my business is that just in case there's a blizzard, there probably won't be, I'm going to make sure there's a lot of milk and bread around for people to have. Is that a viable business? No. Here's why. Because most of the time, the milk and bread will spoil because there won't be a blizzard. And if there is, and I try to charge $100 for a quart of milk, I'll get lynched. And in the same way, if you're the one person, if you're the one company that devises an antibiotic that works when all the other antibiotics are resistant, so you're the one person who holds the magic medicine, I promise if you try to act as a monopoly, it will not be tolerated in any country in the world. And so there's a major market failure when you can't engage in what is fair pricing if you look at it from the beginning, but is very exploitative pricing once you've got to the moment. And that's why there is a market failure here, and you need a government policy. And I don't know what Jim O'Neill is exactly going to recommend, and if I did know, I probably wouldn't be supposed to say. But its character is going to be, I predict, that we announce in some way in advance that if you succeed in this, there will be some kind of big bounty that will come to you that will make it like drilling for oil. Most people drill and they don't get anything, but the people who drill and succeed get a lot. The people who find the successful antibiotic will be able to be rewarded. They won't have to rely on their ability to charge a monopoly price at the darkest hour. And I think that's exactly the right kind of progressive thinking. What I think is interesting and what I think is important, and is kind of at least one of my objectives when I speak at places like this, is that if I think about global climate change, or I think about nuclear proliferation, there is vast amounts of activist moral energy going on. There are people holding concerts, there are people holding vigils, there are people educating 12-year-olds. There's a huge development of moral energy around the importance of solving the problem. And that then drives the world forward. And with respect to these threats, which are comparable, we do not yet have that degree of moral energy. And so I think we both need the moral energy, the political leadership, which George and his Prime Minister David Cameron are providing, and we need the kind of analytical work, because resources are scarce, and we need to do this in the best, cheapest, and most effective way possible. And that's why the kind of research that the center does is so important, and the kind of thoughtfulness that Jim O'Neill is bringing. I cannot resist observing, since you mentioned Jim O'Neill, that while the brick idea was an enormously powerful investment idea until several years ago, those who followed the concept in the last several years and found themselves heavily invested in Brazil and Russia have taken to referring to brick as bloody ridiculous investment concept.
Okay. That may be a topic for another day, actually. Let's talk, Larry, let's just pick up panel, actually. Let's pick up on this idea of the analytical work. And Chancellor, you talked about, we've got to put effort into the research here to figure out what the solution is. But doesn't it exist already with some work that the Centre did several years ago on advanced market commitments? Yeah. And I think, is that what you were going to say, Arvin?
I was going to say, can I say...
Let me just explain that 1 second. So the advanced market commitments is an idea that we incubated here, that is that donors provide an incentive for drug companies to research and bring to market drugs against diseases that predominantly affect people in the developing world. And it's being used as well. And I wonder if you could adapt that to this problem. Let's get a couple of thoughts on that, maybe from George Osborne, maybe from Arvin, maybe from Dr. Chan.
Yeah, look, I think that is the basis of the solution. We're all essentially talking about the same thing, which is addressing the market failure that Larry has very colourfully illustrated, and then finding the way to find a pot of money that will incentivise the production of new antibiotics and new diagnostics. The question, as always, is where does the money come from? And someone once gave me a cartoon 3 or 4 years ago. I was given a cartoon of it was this international conference, and there's a sort of red-faced delegate, and it's the country that offered to pay. And everyone else is looking in complete astonishment at this person who's got their hand up at the conference. So the problem, as always, is going to be trying to find a way to collect sufficient resources when there are lots of calls on that money to provide the market incentives for this big global problem. But I think the work that's being done now with different governments, with the pharmaceutical industry and so on, is inching us towards finding a sufficiently large pot of money, a new source of money essentially, so that we can provide those market rewards.
Just 1 point. I mean, one of the centre's early work was in fact on AMCs and precisely addressing this kind of problem. I wonder, I think the first one on cockle disease. I don't know how much progress it's making. Maybe we need to draw some lessons from that. But what I want to share is something that just struck me as the panel was speaking. There is one example where this kind of, it's not exactly the same, but this kind of issue was addressed, which is the ozone layer problem. Remember, CFCs were causing all this problem. What in fact drove the Montreal Protocol was in fact DuPont, I think, had discovered HCFC, so it had an incentive, and then it had an incentive in actually phasing out CFCs because it had this new product. So and of course then it galvanized the U.S. government and got change going. So in fact, the international regime changed because one private sector actor had kind of discovered the better substitute, as it were. So I suspect that while we have to work very much along the lines that the panelists have been speaking about, I suspect that we could get someone. I also agree with Larry. That's a bit like Uber pricing. That you discover something, you won't be able to charge monopoly prices for that. But this ozone layer DuPont discovery of HCFC gives me, the hope that if someone actually does discover these things accidentally or because they're working on it, because they've spotted an opportunity, that kind of thing might perhaps be a supplementary way.
But that would only apply once there was global resistance to existing antibiotics. If you spend a lot of money developing an antibiotic today, I'm not sure the pharmaceutical market rewards you for that investment. So it's not worth you putting there are many billions of dollars going into cures for cancer, because the market will reward you if you find one. But you are not rewarded at the moment for developing new antibiotics, because there are plenty of antibiotics out there and all being used. The trouble is,
I think the point that Arvind's making that's fair is that if I developed a great new, entirely different mechanism, but it had the same effectiveness as penicillin, I would suddenly become a very strong constituency for a lot of regulation on how much penicillin could be prescribed.
Exactly.
That's I think the
and these are not mutually exclusive. I think that so the ozone layer was for me a kind of interesting thing that happened. But I still want to come back. You never enter into a debate with Larry. But see, I hope that
it's not been my experience in life with you, Arvind.
I hope that Larry is right and I'm wrong. I think developing this moral energy is really terribly important in driving change. I just go by the experience of the last 50 years, where how much have we put in global public goods? And I worry maybe there wasn't enough driving it, but we know that, it's not as if we didn't know that, investment in R&D on malaria or agriculture productivity or many of these other things didn't have a huge return. So I still worry about, what response there might be nationally and internationally to saying, oh, let's invest in AMR kind of stuff rather than other things. It's not a huge insurmountable challenge, but it's something that I do worry about.
And the point you were making about if someone were to discover something, we can't really leave it to chance like that, can we?
No. That's why I said. Oh, absolutely. That was just more a kind of observation based on experience, rather than a kind of a prescription to say leave it, to chance, and that's what will happen. No, just an observation. I think we should continue along the lines.
I think there's one other thing to say, which is, and Margaret will know the most about this on this panel, since she's the only one who sort of has any professional training in anything that's got to do with cells or bacteria or anything. At least I don't. I don't think my friends George and Arvind do either. This seems to me to be a quintessential nonlinear phenomenon, and therefore more dangerous. That is, it's not that this is going to sneak up on us year by year by year by year. It's at some point the bug is going to mutate, and the medicine that did work doesn't work, and then we're not going to have a solution to the problem once that happens. So the world is actually better. The world's doing only so-so, I think a fair-minded person would say, on global climate. But in the case of global climate, you can see it's getting warmer, there are more storms, the river that used to freeze doesn't freeze. You can see a set of things happening, and they kind of alert people to the fact that there's something ominous happening. I think AMR has more the character of a levee that doesn't hold and unleashes a flood, and you don't really see the pressure on the levee building in any very salient way, and so it's harder to get mobilized to prevent Katrina. And that's why I think this is a particularly challenging one to induce the necessary behaviors on. Just like pandemics, we have the flu each winter, and the world keeps turning, and then some winter the flu is going to be very different, and so it's much easier to deal with rheostat problems than it is to deal with light switch problems,
Margaret Chan.
where the switch only goes occasionally.
I think Larry is spot on. The tipping point is not predictable because we are, unlike climate change where you look at the warming, the 2 degree and whatever you can do to reduce that, microbes are invisible. We don't even know when they're going to make the switch. Let me give you the example that is very much talked about today, is Zika virus. I mean, no scientist or global health expert would imagine a mosquito bite can transmit a disease that causes abnormalities, to the brain, to microcephaly, to Guillain-Barré syndrome, and the list is not even finished. The more we know about this, the worrier we get. So going back to the point, you cannot have an early warning. Just like pandemic, one thing we know for sure, it will come. It's not a matter of when. It's not a matter whether it will come, certainly, but it is a matter of when. So I would support the argument that we need to take multi-pronged approach to address this very big problem. And the market failure has been talked about very much, and I fully agree with that. We need to find a financial mechanism that is sustainable to provide the incentive for the industry working with scientists to come together to find new molecules. That is not to say governments of the world have not invested. If I tell you, the US government has BARDA, NIH investment, and UK, China has a fund for AMR R&D, and of course the European countries also have the Horizon 2020. But whether or not all these expertise and already investment can come together. Now the good news for me is in January this year at the World Economic Forum, many industry groups come together to make the announcement. We are prepared to work with governments to find global public good solution to address this crisis. As I said, this is a tsunami, a slow motion tsunami. It's not something you can see after an earthquake, but it will come for sure. The evidence is so clear. I said at the beginning, already every year, we have 700,000 people dying from AMR-related issue. In US alone, 25,000 deaths related to that. So what are we waiting for? We have the know-how. We just need the political leadership. Now, there is a process. Larry, before we came in, you talk about you need to have a process, you need to have a plan, you need to have all these things. The plan was there, the global action plan I talk about, which was agreed by 194 countries at the World Health Assembly last year. Now it is for countries to develop their national plan. What can they do in the health sector? What can they do in the agricultural sector, in the food, to prevent further damage, but at the same time to find innovative mechanisms to create new antibiotics so that the pipeline is not empty. If I tell you, We are down to the last antibiotics for treating gonorrhea. Think about it. We are down to pretty much the last antibiotics to treat some dysentery. HIV, we are beginning to see resistance, tuberculosis, malaria. So can you imagine the millions of women and children in Africa, in others, because of malaria, they continue to die? So can we, use the political energy led by the countries, UK and others, Germany and South Africa, and move the needle further? And I truly believe, the UN General Assembly meeting is a wonderful occasion, and also the G7 last year by Germany and this year by Japan will continue to push AMR, and the G20 this year by China will discuss about the importance of AMR for the world. So I think, I'm quite optimistic about the series of actions going forward, but we just need to figure out the incentive piece.
If that's the sound of you being optimistic, I'd hate to hear you when you're being pessimistic, actually. Margaret Chan, that's a good way to start concluding, I think. Thank you for those remarks. George Osborne, what do you want to leave here with Washington? I mean, what do you want to leave here after the meetings you're having this weekend?
Yeah, I mean, I think there are two things, or three things we're trying to achieve. First of all, you will see in the next few weeks the conclusions of the report the British government, the study the British government commissioned from Jim O'Neill, and that will propose to the world a solution to the market failure problem and a global funding mechanism for the development of new antibiotics and diagnostics. That's the first thing. Second, we are seeking to incentivize government research, and as Margaret mentioned, with China we formed a combined fund, and the Gates Foundation are coming in, and that's a single pot of money to look at government-funded research into the whole area of antimicrobial resistance, and anything that involves the UK, China, and the Gates Foundation does cover quite a few bases. So that's not a bad start. But we want other countries, other institutions, other funds to get involved in that, and there's a completely open invitation for that. And then third, we want to, as has been mentioned, get this going as part of a regular dialogue at the biggest fora in the world, and so. We're working to get it on the G20 agenda this year. It's already on the G7 agenda, and those discussions are happening here so that, when, for example, the leaders come together in China later this year, the President of the United States, the Prime Minister of Great Britain, and the others, they are discussing this issue, at least in part. Won't be the only thing they're talking about, but it's part of that discussion. And my experience, I've done this job for 6 years now. They're quite good. Where the G20 works, and I think Larry created the G20, so I can give him a plug for this. Where the G20 works is where it tasks other bodies, like the IMF or the World Health Organization, to come back with a solution the next time we all meet. It's not the ideal place in that conference room to solve the problem there and then. It tends to set deadlines, task international organizations, and then because there's the country that hosts the G20 wants to have a successful conference, there's a big political incentive to get the thing done for the next meeting, or the meeting where the timeline has been set. So I think using international organizations, international gatherings like the G20 to drive the pace on this is part of what we want to see.
Larry, what's the political cooperation that needs to happen to make this happen? The final point.
Look, I think George got it right. I guess I would just say this. The most important thing that I didn't understand at all when I was a professor of economics, but that I came to understand after working in government, was the importance of process and institutions, which I didn't appreciate at all as a professor. And George emphasized that at the high level, heads of state mandating finance ministers, and finance ministers mandating their deputies, and their deputies mandating the World Bank, and all that kind of process. And that's very important. There's another thing that's very important, which is the rhythms, practices, and customs of those institutions. My friend Peter Sands, the former CEO of the Standard Chartered Bank, has chaired a report and has done a great deal of work more towards the pandemic side on behalf of the National Academy of Medicine. And one of their important recommendations is that as part of the IMF surveillance of every country every year, there be some review of their progress on these issues. Well, if the IMF has to surveil it, then the IMF has to develop a methodology for surveilling it. And if it's going to be surveilled, then the Minister of Finance doesn't want his ministry to look like a bunch of idiots when the question gets asked. And so the Minister of Finance gets the bureaucracy going to develop an approach, and people don't much want to do it, but if they once they recognize they have to do it, they figure they might as well make something constructive out of it. And pretty soon, like something that's new in the history of the world happens, the Ministry of Finance actually asks the Health Ministry a question rather than gives the Health Ministry a mandate, and like something really good has happened. And so I think what I would emphasize is the importance of embedding this in process, and the day we will have succeeded will be when it would seem bizarre if a Washington think tank convened a meeting to say that the international system should focus on the quality of countries' banking systems. It would just seem like a bizarre thing to do, because obviously the international system does. And when we can incorporate a set of these health issues in the same way, so nobody could have a meeting about it because it would be so completely boring, that's when we know we will have brought this problem under control and have solved it.
Okay, Arvind, I'm going to get one very quick last point from you, and then I know that the panel needs to leave, so give us one quick point.
Yeah, and I'll be honest with you. It's kind of trying to put the scale of the challenge. When Larry spoke about developing the outrage, whatever, if you were to come to India and were part of the health discussions, AMR would not feature amongst the top 10. I'm making maybe not top 5, whatever. Amanda, knows better. So there is a parallel effort that's required to actually, make people aware of the magnitude of the problem all over the world. I, for example, didn't realize that there is actually a list which says for gonorrhea, we've basically run out of options. For something else, we have few. I think stuff like that has to happen. Otherwise, our energies are not going to be mobilized around AMR, because we think we have far more pressing challenges to address, and that's something that has to be addressed as well.
Okay, Mark, you want to make one very final point?
One very important point, because Larry talked about the importance of process and institution. I respect G7, G20, but it is not G194. So it is important that G7, G20 start the process. It must go back to all these institutions, including WHO, World Bank, IMF, and FAO too. And then the Prime Minister or the President would summon, hey guys, what is being discussed? And the list of antibiotics that is becoming useless, the Minister of Health would know. But you need to summon them at the cabinet meeting to give you that kind of information. Going back to the point, policy coherence, country ownership.
Larry, 30 seconds, go on.
This is going to take a lot of work, a lot of education, and a lot of leadership. Here's why. There's two kinds of problems. There's problems people know they have, and they want political leaders to fix. And political leaders are therefore motivated to fix them, to make the people happy. And then there are problems that people don't know they have.
Exactly.
So the strategy of telling people they have a problem that they didn't know they have, and then providing a partial political solution is a rather less attractive political strategy for those who wish to have popularity. And this problem right now is in the category of educating people is scaring them.
Exactly.
And success is resolving a large part of the problem, but not all of it. And so this really takes courage and leadership, and that's why what Margaret has been doing for many years, what George is doing, seems to me to be so very important.
Okay, thank you very much. Ladies and gentlemen, you'll understand the number of meetings that people have this week because of the spring meeting, so we're going to let this panel go. We're going to swap them out with another panel. Please give them a round of applause. Thank you very much indeed. Thank you. Thank you very much. Thank you very much. This way. I'm going to invite up Amanda Glassman from CGD and Hala Audi from the AMR review. And we can talk a little bit more in depth about the review's findings and get some thoughts, some reflections on what we've heard today. So Hala, great to see you. Let's get you first of all to start off. What can you tell us about the review that's being published, or what's going to be published next month?
So what was fantastic today is to hear so much talk from the decision makers about taking action. And I think that where I left, the idea I left the panel with was we have to act, and actually it's doable, the solution can be found, and there's no excuse for not starting to act other than it's kind of difficult and we need political leadership, which is exactly what a number of individuals have been doing in the UK.
But that's the kind of ultimate excuse, though, isn't it? It's difficult and we need political leadership.
Exactly. And so I see our job in the review, and it's very much what the spirit and the ethos that our chair, Jim O'Neill, has given the team is just go and find solution, be result-oriented. We don't want to write endlessly about the problem. We want to start shifting towards what in practice can we do. And we're sitting in this interesting governance in that we started our life as an independent review, which would be called a commission in any other country, but in the UK it's called a review. And that was a small team chaired by Jim O'Neill as an independent member of the public. We don't sign off what we say with government. We can meet anyone we want. We're sort of sitting outside. And then during the life of the review, Jim was appointed as a minister in the Treasury. And so we've been inside and outside at the same time since. And that happened at the moment when we were ready with enough of the early solutions to start the implementation. And that's why this work of international engagement is so crucial, because the solutions have to be shaped with others. So I'm very happy now to talk a little bit about what the solutions are and where we're going, basically. So having first set the economic cost of the problem and the human cost of the problem, and these are the numbers that you're hearing more and more in the press, those projections to 2050 of what drug-resistant infections could do in terms of human lives lost. So we modeled scenarios that show if it's not tackled, 10 million people would die every year by 2050. And running this model, this human loss, through the macroeconomic models that Jim O'Neill and macroeconomists are used to live and breathe, the teams of consultants that worked with us came up with this 100 trillion of global output lost by 2050. So that was the first step that we took about a year and a half ago. Since then, we've looked at solutions in a thematic way, going one by one, with one methodology, which is we're going to look at how to reduce the demand for antimicrobials. We need to consume less of them, and that's a sort of permanent shift in that demand curve is the most long-term solution that you can have. And then we're looking at solutions to increase the supply of products, and this is where you hear about the antibiotic pipeline and how to incentivize it. So how do you reduce the demand? Just to start with this briefly, because I think it was less covered perhaps than the R&D incentive, but it's just as important actually. So it goes from reducing unnecessary use in agriculture, but also reducing unnecessary use in humans. And we lack, at the moment, the diagnostics to do this. It's for strep throat, it sort of exists, but for many other infections, you have to wait quite a bit before you know whether you need the antibiotic or not. By which time the patient in a rural clinic in Kenya or my kids at the GP in England have left the clinic, and in many cases that's not a risk that the patient and doctor want to take, and so you take the antibiotic. There are other measures to reduce demand, and public awareness and sanitation are the big ones out there, and we can cover that in more detail if you'd like later on. Then moving on to increasing the supply of products, we're looking mostly at the market for vaccines, which sits actually between demand and supply, because if we find more vaccine, if we use today's vaccine more, including the pneumococcal vaccine that, Amanda, you guys came up with the advanced market commitment system to really increase global coverage. Just using the vaccines that we have more would mean less people become infected and fewer people need these antibiotics, need to take them, whether because they needed them or just because they didn't have the right diagnostics and they took them just in case. So vaccines and the market for vaccine is something that we've looked at and we'll come back to in the final report with our proposals. And then the market for antibiotics, of course, is really problematic for the reasons that Chancellor Osborne and Larry Summers just explained. And the uncertainty is really the key risk. And we work with scientists in so many pharmaceutical companies, and some are sitting here today, and it's nice to recognize familiar faces, and both them and the doctors. So the pharmaceutical teams, they face this problem that they're passionate scientists, they want to do the research, they go to their investment committee teams, and they say, hey, I have this great project, I think I could have another antibiotic. I'm going to need about 12 years and anything between 40 and 120 million. And I have a one chance in, X, the X is really high, to succeed. Will you give me the budget? And oftentimes the company, look back and say, sorry, I could do something else with that money that's less risky. And so that's what the proposal that we made around market entry rewards is trying to deal with, which is to tell the company, when you're doing your sales projection, you don't have to worry so much about when you start selling that new antibiotic. We're going to give you certainty that even if it's not used very much at the beginning, because it's not needed by that many people, you're going to get certainty for your new products. So that's the market.
It's a reward to develop.
Exactly, which is what was focused on by the previous one.
Amanda, I was just making a list of all the things that our panel before talked about we need. Innovation to increase supply, behavior change, financial mechanisms, maybe like advanced market commitments, policy coherence, and leadership at the level of international organizations. Oh, and time as well. This sounds like a daunting list.
Yes, I agree
Elaborate.
with you. Well, I mean, one issue that I'm concerned about after hearing this great panel really is that there is a specific ask here for an amount of money, a set of prizes or let's say an advanced market commitment. There's a need for policy coherence. There's a need for countries themselves to focus on use and overuse. All of that has a price tag. And the big question I think on the table is, where is that money coming from? So far, and I was a little disappointed not to hear a specific suggestion of where that money might come from, where it might be sourced. As I mentioned before, our President, Nancy Birdsall, has long worked on the issue of global public goods, focusing on some kind of funding mechanism at the World Bank. That hasn't progressed in concrete terms. So I guess one question is, will that go forward? What would that look like? What is the size of the prize that's needed to genuinely incentivize research and development of new diagnostics, new medicines, new vaccines, and to do this in a thoughtful and sustained way over time? So that's a big question mark. I think our job probably is to continue to push and sustain the momentum that we've seen today.
No, absolutely. And what we're doing is really put numbers on these, price tags on these issues. And so we'll do that in hopefully about a month and a half in the final report that we'll publish. But the price tag that we put already on the antibiotics and diagnostics research is We've got a range of $15 to $35 billion over 10 years that are needed. And for antibiotics, the market entry reward that we were talking about, to bring companies back in the game, we've modeled that you'd need prizes of around $500 million, a range between $500 million and $1.5 billion, depending on the characteristics of that new drug. If you compare that sum, and let's call it 20 billion over 10 years for simplicity, that's 2 billion every year to revive an essential drugs market and inject life in it again. That's not a lot. The antibiotic market already today is $40 billion. So you're talking about 2 billion injection in it every year. In pharma terms, and compared to the price increases that health systems have sustained, for good or for bad, that is not that much money. And I think it's important to say that if you start mixing and matching the funding, including the ideas that you have developed with Nancy Bertel and others around the role of international financial institutions, if you also use perhaps some of the global AIDS money, for instance, for market entry reward for tuberculosis, and if you ask possibly industry to contribute, because as Larry explained, the pharma companies are the fishermen in the fisheries. The pharma relies, like society, on antibiotics being available to sell other lines of businesses, such as cancer or surgery equipment. All of this relies on antibiotics being available. So it's part of their own interest to sustain the stock, the available stock of antibiotics. So I think the top message is it's not that expensive in the big picture, and it's a rounding error in the bottom line of the G20 governments or the companies or the World Bank. And if you take those three pools of money together, you're really not talking about a lot of money. You're talking about difficult collective action, and political leadership is more difficult than the sums involved.
Okay, great. Let's, in the last few minutes, get some questions from the audience, and let's see who we can speak. And Karen Shaw from Pew, we'll get the first one from you. So do you have some microphones going around for our questioners? Yeah, great. One to you, and then we'll get one from you, sir, in the front row there. Family hold back, Mead.
Family hold back.
You can talk to them anytime.
Thank you so much to you both. Carolyn Shore, the Pew Charitable Trust. Just wanted to thank the Center for Global Development for your leadership on this issue, and thank you to Hala and your team for putting together a fantastic body of work on this important issue. So in the panel discussion today, the panelists touched upon some of the ways that government and global organizations could address some of the stewardship and development issues to incentivize new antimicrobials. And I know a number of people in the audience here understand how difficult it is to find new antibiotics, technically, scientifically very difficult. And at least with a few exceptions, it seems that for the early stage research, all too often basic research is siloed, and scientists spend a lot of time reinventing square wheels and coming across the same roadblocks time and time again. And I was wondering if we could get your thoughts on how to better leverage collaborative activities, tying in some of the points that Dr. Chan had made about existing research efforts that are currently ongoing.
Sure.
Why don't we take the answer? Yeah, why don't we take the question first?
So I think that's an incredibly important point, and let me just recognize the amazing work that Pew Charitable Trust have been doing on this issue for many, many years. And I have to say your study of the pipeline of antibiotics is one of the most useful tools that we have available to look at really how good or how bad things are. I think that the point of early stage research, getting more funding and getting more efficient, is incredibly important. There are lots of different ways to do this, and some depend on money. Some, as you say, depend on working differently, partnering, and getting some transparency in the field. In terms of the money, I think, as you know, we called for a Global Innovation Fund focused on antimicrobial resistance of $2 billion over 5 years to really kickstart early research in basic science in this area. And the reason why we called for that fund wasn't because we wanted to have, our baby or yet another thing or yet another institution, given that there is already a lot of medical research funding done by the NIH and BARDA and the medical research councils of the world, the European Union one, the UK. So why a global fund on AMR? And the reason is really, I think, what you were pointing at, which is people tend, by applying to these grants, grant-led science-led investigations and grants, they tend to repeat the same work. Whereas if you have one center that is funding everything at the same time, with a little bit of direction, you would hope that you'd stop repeating the same question several times, and you'd also, over time, start opening up the libraries and the stock of knowledge that some companies have and some academics have, so that it's better shared, basically.
Just to say, I think, first, a kind of pull mechanism for R&D should incentivize innovation in partnership as well, right?
True,
because
true,
to
exactly,
get to an AMC or something like that, the idea is that you would actually create that very visible incentive that would get groups that don't normally work together to work together. But the second thing, I think, in global health that's been quite interesting is the product development partnership idea. Where you're forming alliances, you have a target product profile in mind maybe, and you're bringing industry, but you're also bringing not-for-profit, you're bringing universities, you're bringing manufacturers together to think about what are the attributes of a product that could meet the needs of this, of a pull mechanism or something like that. So I think it's probably worth looking at that pretty carefully. We've had, 15 years of experience with that, so. Yeah.
No, absolutely, and there's some things already happening, and there's a sort of new product development partnership focused on antibiotic resistance called GUARD that is being incubated and started in Geneva, and I think that's a very good thing. We might need others, but these, as you say, Amanda, would be the right recipients if they do the right grants and compete for the money for the Global Innovation Fund. But almost as importantly, they could also get the pull money, the payment for success that we're talking about. The point is to open up the competitive field and get more players from more different places. The problem with push funding is that governments like to fund their own scientific teams, which is understandable. But the market entry reward would be there to be got by anyone who found the antibiotics. And so I think that will pull partnership and working together. And if that all come to pass and it exists, I would love a product development partnership or a consortium between private and public players to get the money and reinvest it in public research.
Okay, let's get another question from this gentleman on the front row over here. And then we have time, we'll go to you, sir.
Yeah, David Bryden from Results. It's really interesting to have the panel earlier. Fascinating comments on, especially from Larry Summers, on the importance of advocacy, which is what I'm doing, and I feel he made some really important comments about the need for investment in that, and using the media and so on. But I wanted to ask about the relative place of tuberculosis within the AMR review, because as we look at all the AMR infections, that's the leading killer, even though that might not be a well-known fact. And I think in some countries we have to face the fact that it really, and I think it's a global phenomenon, not just in Asia, but in Asia in particular, I think we have to say that there is a lot of stigma about this particular disease, and stigma in such a way that can lead elite decision makers to think, really, that's not our problem. That's not our community. That's the poor masses, and good luck to them. So I really think that there's an issue with this very particular disease that we have to anticipate, because it is extraordinary to think that you take India, for instance, or in Mumbai in particular, they have a generalized epidemic of drug-resistant tuberculosis. That doesn't seem to be very widely known. Just judging on the previous conversation.
I agree completely, and tuberculosis and resistant TB is at the heart and front and center of our work. I think we would not, to be honest, personally, I think we would not succeed if, in the end, we have pull incentives and TB isn't one of the biggest recipients of those incentives. It's absolutely at the heart of the problem. 2 points. You're absolutely right that so as you know, David, MDR-TB kills 500,000 people a year. So when we put out the number, the figure that 700,000 people today die of AMR, that's 500,000 dying from TB. And what I think is really important is I didn't know this before I started work. I knew nothing before I started on this review in this field, but I didn't know that the drugs that you use for TB are antibiotics, actually. They're a combination of antibiotics. And so one thing that we're really very keen on is that once the details of the pull incentives for antibiotics get worked up, it's absolutely crucial that indications for TB are marked within the criteria for getting the big rewards. And so the worst thing that could happen is that you get a good new pull incentive for antibiotics, but TB isn't on the list of indication for whatever reason, and you have so that's something that's really important, and we need results and the Stop TB Partnership and others to keep that really high on the agenda so it doesn't slip.
Amanda, if you don't have a point to make on that, we'll move to the last question. This gentleman here, I think that'll probably be the last question, actually, just for time reasons.
Hello, Guido Dano with the Netherlands Embassy. First of all, thank you for this excellent panel. It's been very telling to what is happening right now here and in the world on antibiotic resistance. So thank you for that. I'm also very interested to hear all the work that's been done by the review. And I was wondering, as antibiotic resistance is also something that occurs in nature, that we've seen this from the time when antibiotics were discovered, that resistance occurs naturally. So I was wondering if what is being done to also look at when we have a little bit of a breather and we have some new antibiotics hopefully in the pipeline, what is being done to sort of make the next step and look towards what we can do to actually solve it more permanently, let's put it like that.
No, please.
That's
a very hard question. So.
That's a really interesting way of putting it, and I think there's two things. One is if you reduce the demand for the products, you really slow down the rise of the resistance, because the resistance to the drug arises from microbes getting into contact with the drug. So a few examples. Pollution. When antibiotics get manufactured, the active pharmaceutical ingredients don't get treated or filtered or whatever is the mechanism, and a lot of it goes into waters. This water is in rivers. Imagine them upstream near the manufacturer, near the plant. Water goes down the river, meets a large city. The city has sewage systems that aren't amazing. Some of the sewage goes into the water, meets the antibiotic active pharmaceutical ingredient, and there's a fantastic soup for microbes to meet drugs and create superbugs. That's quite a big problem, and that's something you can solve. Again, it's man-made, and you have a man-made solution. In fact, there are factories in the same countries that are competitive in India, in China, in Europe. They're all competitive. They're all selling their product. Some are better at treating the active pharmaceutical ingredient than others. So that's one way of, if you lower the meeting of the microbes with the drugs, that's a way to lower the rise of resistance. Others are the demand reduction ideas that I mentioned earlier around agriculture, use, for instance, when it's unnecessary, etc. But to finish on a more futuristic note, and I think Arvind Subramanian mentioned that earlier, and there is something about finding new drugs that could do the same job as antibiotics, but wouldn't be antibiotics and might not have the same resistance problems. There's a lot of clever people working on this. They're very long time away. So we need to fund that research, and I think Caroline and the Pew Trust and others are thinking about these alternatives to antibiotics. They're really important, and let's fund them, but let's not count on them to come soon enough that we don't need to do more research into antibiotics because it doesn't look likely.
Amanda, why don't you just give some comments to wrap up?
Well, just to say thank you. I think we're all really looking forward to the recommendations that will come out of the AMR review, and also to holding the G20, G7 international financial institutions leadership responsible for follow-up and next steps, and just to really congratulate you on the incredible work that's been accomplished.
Thank you.
So thanks very much.
And please thank our panel. Thank you. Thank you very much for coming, ladies and gentlemen.